Hello, everyone. My name is Shakil Rezaifti. Uh, I am a postgraduate student at Istanbul University in the Faculty of Communication. I have done my undergrad also in the same faculty and same university. I am from Bangladesh, and currently I'm serving as the director at Bangladesh Study and Research Center at Istanbul Gedik University. I'm a writer, a podcaster, and a documentary filmmaker. Uh, and I'd like to thank Professor Dr. Balgin Erhan, who is a very dynamic and a very wonderful uh, doctor with a very, great team. And I feel so blessed and so lucky to be a patient uh, under Professor Dr. Balgin Erhan. Thank you so much, Professor, for giving me this floor to share my experience as someone who has been experiencing spinal cord injury and spasm as a result of that. So it all started 3 years ago when I was diagnosed with a very rare sort of bone tuberculosis that affected my backbone. And as a result of this tuberculosis, my backbone, got some sort of fracture, and I started to feel immense pain. I went to doctor, and doctor suggested that I should get some surgery. I mean, I had to undergo three major surgeries, and after the surgeries, I found myself um, totally paralyzed. Doctors installed 14 metal plates on my backbone, and my lower limb became totally paralyzed and totally numb. Uh, the first 6 months, I was not even able to sit properly. I didn't have sitting balance, but slowly I started to get spasm, and spasm helped me to, start practicing sitting balance. And now I'm in a point after 3 years when spasm is even helping me to walk with walker. So I'm really blessed that I have spasm, because I know a friend from India who doesn't have any spasm. She has been suffering for 8 years now, like with spinal cord injury, but she doesn't have any spasm, and she prays a lot so that she gets a little bit of spasm, a little bit of spasm that I have in an immense level, in a severe level. So, because she cannot walk at all without spasm, she has been trying all day and night, but she cannot walk. But I can walk with spasm. So sometimes doctors even suggest me to install a baclofen pump because my spasm is so severe. I even went and got myself admitted into hospital to get the baclofen pump installation surgery. But after getting the experiment dose, I didn't quite like it because it made my lower limbs numb again, and it reminded me of my first few months, when I was not even able to sit properly. Uh, I take baclofen orally, like 10 milligram baclofen for a day, each 10 milligram. So one, 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 one. Even there was a point when I used to take seven baclofen, 10 milligram each, two, 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 and one. So that was the highest amount of baclofen that I took for my spasm. So yeah, having spasm comes with so many, disadvantages as well. For example, I need to face very immense neuropathic pain for what I'm taking pregabalin, though I have been trying to reduce the dose of pregabalin. But getting a baclofen pump installed on my body could maybe release my spasm totally and help me, be zero spastic. But that would not be wise because I would not be able to walk, which I can within the house. I can walk with walker. Though this much walking is not enough, when I go out, I am always using a wheelchair. But then again, I can walk. I can do a little bit of movements, which I think is good. When I sleep, I mean, when I'm on my bed, I can turn right, turn left, and I can do all sort of movements that I want. So spasm, yes, it comes with neuropathic pain, but it is helping me to maintain a very quality life, I would say. I sometimes make fun this way that initially spasm was not a good friend of mine, and I was not a good friend of spasm. We used to fight all the time, and we used to be enemies. But very soon, slowly, I began to get the whole picture that I have to be with this spasm for maybe throughout my life. So it's better to be good friends. So now we are good friends because both Spasm and I, we know that we have to be together forever. So we are now very good friends, and that's how we started to live happily hereafter. So, so this is the happy hereafter story of me and my spasm. I hope you enjoyed it, and I'm so grateful once again for having this opportunity to share my experience to all of you. Thank you so much to you all who listened to me, and thanks for choosing to be doctors and for serving humanity, for serving us, the patients, uh, patients of around the world. Thank you. Thank you so much. And thank you to Professor Dr. Balgin Erhan once again for being so nice to all your patients. I hope I could help with my experience. Signing off, Shakil Rezaifti. Bye.